Hello, my name is Hayley and I'm a laryngologist at Columbia University in New York City. In today's OtoNotes High Yield Series, we are going to be discussing the augmentation materials used for vocal fold injections to help with glottic insufficiency. This can be a result of either vocal fold atrophy or vocal fold paralysis, and the augmentation materials are meant to increase vocal fold closure, which helps with voice, breathing, and swallowing. The material that you choose depends a lot on the duration that you're hoping to get out of the material. A short-term material like carboxymethylcellulose, commonly known as voice gel, is one that's very good for a test injection. It's a safe material and can be easily obtained in the hospital at many institutions, as it's FDA approved for this indication. The material is expected to last somewhere between 4 and 8 weeks and gives the patient a good idea of what effect a medialization injection would have on their voice, airway, and swallowing. It's a great way to test to see if the patient would benefit from a longer-term injectable. The mid-range injectable, as far as duration, are the hyaluronic acid-based injectables. These take a variety of forms, most of which come from the cosmetics world, and they tend to last somewhere between 6 and 9 months for the patient, for best effects for the patient. Many of these materials contain a little bit of numbing medication, which can help make the injection more comfortable for patients. And providers like the ease of injection as well as the flexibility of the material. The other nice thing about these materials is that there is a antidote essentially, and you can use hyaluronidase in cases where the injectable gets into the wrong layer of the vocal fold, or in cases which the patient has an adverse reaction. There are patient reports and anecdotal reports of an inflammatory reaction to any of the hyaluronic acid-based materials, but this is relatively rare and usually can be managed with steroids and voice rest. Longer-term injectables include calcium hydroxyapatite, CAHA, which is a material that is expected to last for 9 to 12 months. This material is a little bit stiffer and more difficult to inject through a small caliber needle. However, it gives a very long duration of effect and is a great option to use in patients who have a malignancy and are looking for a quick improvement in their ability to speak and also to improve their swallowing. Things that are considered semi-permanent or permanent for medialization injections include fat, which is grafted from the patient's own body and injected into the vocal fold for medialization. The difficulty with fat is that it does get reabsorbed, and it's very unpredictable how much it will get reabsorbed and over what period of time. It is expected that at least some of the effect of the fat injection will have a long-term or permanent effect. There are newer materials that are coming out in the literature every year, the most recent of which is a silk-based injection that has a hyaluronic acid base, and this is put forth as a permanent injectable material as well. Obviously, if the patient requires long-term medialization and does not wish to be re-injected, you can always proceed to a procedural medialization like a reinnervation or a thyroplasty medialization. I hope this was helpful, and obviously reach out if you have any questions.
Thanks for listening to OtoNotes High Yield Series. Remember to like and follow for more on the Go ENT education.